We know that kids move more when they're outdoors, so they're more physically active, they're less sedentary. They're engaging in activities that they're figuring out what they want to do and how they want to do it. They don't have an adult telling them what to do. And so that's really good for building cognitive, executive functioning skills and keeping their attention on a task.
Welcome back for another amazing episode of Let's Move Canada. We're your hosts, Dana and Luigi from the Canadian Health and Fitness Institute. And in today's episode, we are giving you two guests, right? So we will have pediatric emergency physician Suzanne Benno and developmental psychologist Mariano Brussoni about what inspired them to pursue careers that focus on children's health. Now, before we dive into that, let me start again by saying that our podcast is brought to you by the Canadian Health and Fitness Institute, a national organization whose mission is to make Canada the fittest nation on earth by 2030. And of course, our goal is to raise awareness about physical and mental health. So now, let's introduce today's guests. First off, we have Dr. Suzanne Benno, a dedicated pediatric emergency medicine physician based in a hospital for sick children in Toronto, Ontario. Now, beyond her role as a physician, Dr. Benno is an associate professor at the University of Toronto and is the co-medical director of trauma at SickKids in Cahir of the Injury Prevention Committee for the Canadian Pediatric Society. Mouthful, wait until you hear the amazing experiences that she has. Her passions also lie in enhancing pediatric trauma care and injury prevention and control. And next, we have the amazing and equally inspiring Dr. Mariano Brussoni, the Director of Human Early Learning Partnership and a professor at the University of British Columbia in the departments of pediatrics in the School of Population and Public Health. Now, as a developmental psychologist, she's also an investigator with the British Columbia Children's Hospital Research Institute and the British Columbia Injury Research and Prevention Unit. Now, Mariana's acclaimed research delve into children's injury prevention and the significance of children's unstructured outdoor play, exploring both its benefit and associated risks. Suzanne and Mariana, thank you so much for being here. I hope I did you justice. Welcome, welcome, welcome.
It's a pleasure.
Thank you so much for being here. So the first question we have is actually for both of you. Can you both tell us a little bit about your journeys to the careers you have now and what inspired you to work specifically with children?
Yeah, absolutely. So I have experience working with children and youth when I was a teenager myself, and as a young adult. So I was a lifeguard and swim instructor for many years and a gymnastics instructor. And so I had exposure to children and youth through summer jobs and university employment and volunteer work and so forth. And I had an open mind to all ages and all disciplines when I started medical school, but I found myself keenly interested in pediatrics when I did that rotation, and the various electives and experiences that I organized then in pediatric medicine and so forth really solidified my career choice.
Wow, that's a lot, actually. Gymnastics, going from gymnastics to being a doctor, that's amazing. And Mariana?
I was always really interested in psychology and kind of what was going on in people's brains and what made them tick. And children in particular, they change so much so quickly that when I went into psychology and did my PhD work, I really wanted to understand what changed, what happened for them, and how we could make sure that we structured our world in ways that best supported them. And so, as I came out of my PhD, I was really passionate about doing research that made a difference for children and families' lives. And injury prevention just fit that niche. It was, as the leading cause of death for kids, and being able to really make a difference and support kids in kind of living their best lives and experiencing adventures while keeping them safe. It just was a real form of passion for me.
Really love that. Just love it. I love how you frame that, right? Like living your best life, but doing it safely, because the human nature is really that much about having adventures, right? But as long as it's safe, that's how we want to live it. So, Dr. Mariana, now a lot of your research has been around the topic of risky play in children. Can you tell us more about that and exactly what it entails and why it's so important, right? I mean, you started giving a little bit of an intro there about it, but can you tell us more about it?
Yeah, absolutely. So the way we define risky play is thrilling and exciting forms of play where children are engaged with uncertainty and there's a chance of physical injury. And so if you think about that definition, actually probably the easiest way of understanding it is to think back to your own favorite childhood play memory. And when we ask people about this, they often talk about, a sense of joy and fun and wonder and being outside with their friends and doing what they want and how they want to do it and kind of limitless time to explore things. And so they're engaging in thrill and excitement. It usually involves things like, say, pushing themselves past their previous limits, like climbing higher, jumping farther, going faster, trying out when they're building something, trying out something more complex, rough and tumble play, those sorts of things. And so it gives them the thrill, the excitement of pushing themselves further. They don't know what's going to happen. Anything could happen. That's part of the thrill. And it's part of also them learning to deal with the uncertainty of the world and kind of building those skills around that. And of course, the chance of physical injury is they're moving their bodies in new ways. And that's part of what my research has looked into. And so you can look at those experiences and actually map them onto really important parts of children's development and health and well-being. We know that kids move more when they're outdoors, so they're more physically active, they're less sedentary. They're engaging in activities that they're figuring out what they want to do and how they want to do it. They don't have an adult telling them what to do. And so that's really good for building cognitive, executive functioning skills and keeping their attention on a task. They're hanging out with friends and figuring out how they're going to get along or not, and having fights and resolving and all that. And so that's really good for social emotional learning. Things are going well and they feel like self-confident, I did it, or things go wrong and they realize that they have the resiliency to be able to, like, you know what, it wasn't the end of the world and I figured that out and I actually have this confidence to tackle the next thing. So that's just a kind of an example of some of the many things that risky play can offer children.
What age do children typically start risky play?
Well, like babyhood. So if you think about even how you learn how to walk, that's an incredibly risky activity for a little kid, right?
Right.
And so it's something that starts from early on, and they just build their skills, and over time they're just figuring out, what they're comfortable with, how can they move their bodies, how the world reacts to their bodies, and as they gain in skill, they can push themselves a bit further and try something harder. But it's something that starts right at the beginning of life.
Okay. Interesting. So, Suzanne, as a pediatric emergency physician, you see a lot of injuries in children. So what is your perspective and your thoughts on the findings of risky play being beneficial for children?
Yeah. It's so definitely, I see a lot of children in the emergency department with injuries. Just to give you some context, in our emergency department, we see between 70 and 80,000 children per year, and about 20 to 25% of those are presenting with some sort of injury. And so in addition to seeing that spectrum of injuries that are very, very minor all the way up to catastrophic, I am also a trauma team leader. And as mentioned, I direct the trauma program. So I have exposure to all of the children who come to SickKids with serious enough injuries to activate a trauma response. So as you can imagine, these situations can be extraordinarily tragic, and I have a very healthy respect and caution for the potential for severe life-altering or life-ending injury, and also for the sequelae that it has on children and their families, even when the outcomes are positive. So that's in fact a huge motivator for me to work in injury prevention and to prevent these events from happening in the first place. So with that being said, in terms of that background of what I see all the time, I love Dr. Brussoni's work. I think this is so important, and I really believe there has to be a balance between the anticipatory guidance that we provide to prevent serious injury versus all injury, and how that intersects with our guidance towards play and the critical beneficial effect that outdoor active play or risky play has on child development. I like really that it's very clearly defined, actually, that there is that specific definition for what is risky play, what it's not, and the guidance around differentiating hazards from risks, and the strategies about how to balance play that leads to optimal development with the potential risk of injury. And the conversation was really started with the excellent research and advocacy done by child psychologists like Mariana. And as pediatricians, we have a responsibility in being informed about this body of work and translating that knowledge to our patients, to our colleagues. And our recent position statement from the Canadian Pediatric Society on risky play is really an endorsement of how important this issue is. It's also a very firm statement with respect to what risky play is not. And the recommendations are clear about eliminating hazards, not throwing out proven evidence-based prevention strategies like safety restraints, bicycle helmets, and so forth. And we know that, the majority of severe injury in children occurs in situations where there are hazards or, in the setting of traffic, for example. And that's what's so compelling about Dr. Brussoni's work is that we may, as a society, have been inadvertently depriving children of these necessary play experiences, thinking we're protecting them, but actually that type of play isn't on a population level the reason that we're seeing children and youth in the ED with the severe injuries that have long-term consequences.
Wow, that's interesting. So you're saying that the actual risky play isn't really what's ending the children up in the emergency. It's more like where, hazards around them, like playing in traffic or not wearing a helmet or not using restraints, things like that. But the activity itself is healthy, really.
Yeah, exactly. And, Mariana can expand on this further in terms of the research that she's done, but that type of play isn't, the risks or the injury rates that are associated with risky play are actually lower than injury rates that we see with organized sports, and certainly significantly lower than the type of injury patterns and rates that we're seeing with motor vehicle related injuries and various other, significant mechanisms.
So you could say maybe it's more dangerous just, being in a car or something than playing sports.
I think 100%.
Yeah. It's funny because I feel like I'm going to be this, like, I'm going to try not to be a helicopter parent, you know what I mean? But it'll totally freak me out if I have, kids that are wanting to go dirt biking and wanting to go, and of course I'll let them do it. But I can totally see where that fear comes from. Which is kind of crazy because when I was a kid, I was like that. I was a snowboarder. I always, wanted to do the jumps, and I was water skiing, and I was doing all of these mountain biking and everything. And my mom just never, she would just stay home because she didn't want to see that. But I can totally understand. But when you're breaking it down and saying it's really not rational to think that way, right? It's like it's rational to be more afraid of your kids getting in the car and driving than it is for them to go mountain biking or something like that. So that's a good thing to think about.
All of this, it makes me think a lot about. I don't know if there's a relation to it, but I remember being in school. So I studied exercise and health science in undergrad, and at some point I remember Piaget's different stages of development. I wonder if it's more emotional, or is there a connection between the work that you do, Anna, in Piaget's stages of development for children?
Yeah, absolutely. I mean, if you think about development, and you think back to your own developmental journey, the amount of risks that you had to take, both emotionally and physically, in order to kind of go through your developmental stages, we don't think about that, right? But it actually is. It's a very risky proposition to develop as a child. So I gave the example of walking earlier, and how, that for a child to kind of let themselves go and get a teeter on and try it out and know that they're probably going to fall down and hit their heads and all of that kind of stuff, but that's just part of life. And we accept that kids have to do that. And we also accept that they have to take emotional risks, like, you know, reaching out to a new person to become a friend, or, you know, trying something new in school or whatever, you know, and those just have to be part of life. And what we've done over time is we've tried to eliminate those, in, you know, in good conscience, trying to keep what we thought were keeping kids safe, when in fact we've eliminated really critical opportunities for them to develop fundamental skills to keep them, so that they actually, when they're adults, are actually capable of taking on the risks, the uncertainty, the challenge of their world, and be able to make, you know, their own risk benefit assessments, the risk decision makings around different situations, to make decisions that are actually in line with what they need, with their values, and so on, you know, without feeling too afraid and anxious and worried that they're going to, say, make a mistake or get
Right.
something wrong, or, you know. And so we really, we as children and as adults need to be comfortable with risk, because our life is inherently risky.
Right.
What would you say were would be the consequences for children that do not engage in risky play?
We have more and more research around that, to be honest, and a lot of it at this point is retrospective. So looking back, of people reflecting on the kind of experiences in parenting they had. So if you think about, so there's really new interesting research from psychologists in the UK, Helen Dodd and Kate Lester, who are looking at, so they actually treat anxiety disorders in kids. And one of the kind of the common cognitive distortions in anxiety disorders is, like, if you have an ambiguous situation, that you're more likely to see it as threatening or harmful, right? Whereas, you know, if you have experience, so, you know, I mentioned right off the top, the definition for risky play was a feeling of thrill and excitement, right? So that the way that feels in your body is actually the same as when you experience a danger or a hazard. It's activating the same parts of your body. And so it's your mind that's deciding that that's, like, dangerous, stay away, or that's a thrill and excitement, right? And so
Right.
when you have kids with anxiety, they're more likely to move towards the danger, hazard, stay away, stop, and they're going to withdraw themselves from the situation, right?
Right.
And so in situations like play, which really, as we talked about, you know, the injury rates are quite low. They're really relatively safe situations. They're really good situations to be able to explore these things. It gives kids the opportunity to have these really strong emotions, their bodies activated with the, you know, with these strong emotions, and be able to be more likely to move towards the, I can handle this, and this is thrilling and exciting, versus this is dangerous and hazardous and I should stay away. And so we find that kids, there is an increase in mental health conditions, an increase in anxiety disorders, and with kids, you know, not being able to handle those things, or, you know, are having very protective situations, and then going off to university and not having the risk management skills to be able to make decisions in situations that are much higher risk, you know, like sexual health, like, you know, alcohol and drugs, or those sorts of getting into cars and doing dangerous driving. Those are much more risky situations, and we want to make sure that kids have those skills in hand before they get to those places.
Right. So, like, allowing children to indulge in risky play prepares them for the challenges of life ahead that are going to be even
more dangerous,
more dangerous,
more high risk, more at stake.
Well, that's super important for everyone to hear.
Very important. So it really helps them. I always think of the fight or flight response, right? It's very much, if you've seen something before and you consider it dangerous, it sounds like if you're used to engaging in risky play, and really in a healthy way, of course, that's not leading into serious injuries, you're most likely to have that fight, right? But you kind of go into flight mode if you're not really engaging in risky play. So it's being less risky as an adult. Yeah.
Well, it's allows you to ground yourself and not get
Of course.
flooded by something, right? And so being able
Absolutely.
to kind of, think through the situation, but also not avoid the joy of life, right? So
Right.
like not have the default be that's too scary, that's too dangerous, which is part of the problem when people have anxiety disorders, is that they retreat because it's too
Mhm.
scary, right?
Mhm.
Yeah.
It's interesting because uh, I always think of where you draw the line in risky play, because things have, again, the potential of becoming so dangerous. So I wonder, for parents who or feel that things are too dangerous for their kids, and Suzanne, you can answer this, right? What are the most common injuries that you see with children coming in? Because again, you have kids engaging in risky play, beyond a certain point it starts getting too dangerous. So I'm curious to know what those common injuries would turn out to be when kids kind of like surpass that threshold.
Yeah, yeah, absolutely. So the most common injuries that we see, by and large, are soft tissue injuries, scrapes, bruises, lacerations. We do see fractures, and we do see head injuries. So those
Wow.
categories are the most common injuries that we see in children, and that's really ubiquitous across all emergency departments. There are certain mechanisms that will predispose to other injuries, like chest and abdominal injuries. Um, And then, like we talked about, the serious injury is generally related to traffic-related injuries or motorized vehicles, these sorts of things. We do see injuries from falls. We absolutely see recreational activities forming a part of, a mechanism of why kids come in. But that's usually when hazards aren't really ideally mitigated, or when
Mhm.
children and youth are using motorized vehicles, so ATVs and so forth, that they aren't ready for.
Oh, yeah, right,
Yeah,
right. Those are
and
dangerous.
and a growing category of fatality in youth that is captured under injury statistics is unfortunately suicide, and we can't really
Oh,
ignore the mental health challenge that society faces now, and the impact that's having on our youth as well.
Yeah.
I was going to ask, how does what the injuries that you see in risky from about coming from risky play or coming from motor vehicle accidents or anything like that, how does it compare to um, all of the rise in metabolic disease in children from sedentary lifestyles, as like obesity and diabetes and all that in children?
Yeah, with respect to comparing injury and the consequences of sedentary behavior, I'm not sure how accurate a direct comparison is as of yet. We know, Mariana had mentioned it at the top. We know injury has been the leading cause of death in young Canadians 1 to 44 years of age for a very long time, with some shifts in epidemiologic categories within that group. And for children, the majority of the deaths are related to traffic incidents. The majority of hospitalizations are related to falls. And there, Statistics Canada data shows that between 0 and 14 years of age, for example, there are probably around 200 deaths annually per year, and about 3,500 children have disability that they're left with after that
Oh, wow.
injury. And then when you
Mhm.
add adolescents, older adolescents, like 15 to 19, that actually doubles the fatalities, with about half of that being intentional and half remaining unintentional. And there is this huge uptick in anxiety. And the prevalence in youth since 2012 to 2018 has gone from, 34 to 44%, I saw in the literature. Additionally, about 10 to 15% of Canadian children and youth are considered obese, and 25 to 40% are considered overweight. And so I think the consequences of this will likely become more evident to us in a few decades, especially if contributing behaviors are learned and normalized and carried into adulthood. And perhaps then we can make a better direct comparison. I don't know if that answers
Mhm.
your question, but it's a little bit hard to compare. I don't think we're seeing the full extent of
It's
the.
actually pretty alarming.
It's very
The rates of overweight children, over obesity, and mental illness.
yeah, it's a lot.
Has the mental illness have those rates gone up quite a bit in the past 10 years, or and do we know why?
So what I'll let Dr. Brussoni speak more to that, but I will say yes. From what I know of the literature and what I see in our emergency department, absolutely yes. These rates have dramatically increased in the last 10 years.
Yeah,
Yeah.
Mariana, you can tell us more about that.
Yeah, absolutely. Yeah, it's kind of a very scary thing to see. And I guess what I would want to kind of clarify, we've been talking about injury rates and so on.
Mhm.
So just to be really clear, the leading causes of injury are motor vehicle crashes and suicides, right?
Wow.
And so
Wow.
it's ironic that the very things that we're doing to try and keep kids safe, so like driving them around in cars, you know, from one activity to another, making sure they're not supervised, so they're always kind of not letting them walk or bike or places, and kind of limiting their freedom, keeping them supervised, making sure that they're in activities that kind of get them into the right schools, etc. That those are the very things that actually increase the likelihood of both car crashes and suicides.
My.
So, you know,
That's
our very
insane.
best intentions are having the opposite effect.
Very
Right.
detrimental.
And so when talking about mental health, I mean, it's complicated, right? There, you know, the world
Mhm.
is a complex place, but there's a few things that have been pointed out too. So, you know, like the restricting of children's freedom, there's been research by others, as well as we have an article under review right now, actually looking at the extent to which kids' independent mobility, their freedom to kind of go out and explore their neighborhoods on their own, has been restricted, and how that's associated with their mental health and
Mhm.
mental self-reported and parent-reported mental health. And so, in fact, finding that as kids' freedoms are more restricted, you see a strong correlation with higher mental health conditions, right?
Wow.
And so you have kind of the way that we've patterned society to do that. At the same time, we have, you know, phones that are really interesting, kids engaging on those phones for huge amounts of time of their day. That's where they're socializing. We've seen socialization in person go down over time. That was even before COVID. It went down dramatically during COVID. So that exacerbated things. We've seen increasing pressures for kids as they're pushed to succeed, because we have, you know, an increasing distance between the rich and the poor, where we've had more and more difference there, and parents are realizing my kids have to get a higher level of education and higher level of achievement to even have a comparable, if not lower, lifestyle than I had, you know, at their age. And so parents pushing their kids to succeed, and a lot of fear around that. And so like spare time is going down, homework is going up, time on screens is going up, freedom is going down, our expectations of kids and their independence and their ability to handle things is going down. You know, so it's complex, but
Mhm.
it is, you know, very much related to how we support our children in society and the kinds of opportunities that we give them.
Right. So
This is so much.
I
Go
know
ahead, Dan.
it's like it. I'm sure there's a lot of people that would listen to this and go, "Oh my gosh, I've been doing this so wrong, or thinking about this wrong," right? Um, so the more restrictions, the more safetyism, the more you know trying to keep everything safe, you might actually be contributing to some mental illness, or right
Having the
in
inverse effect.
that direction, right, trajectory. And the more freedom to explore, the more freedom letting your children, they're going to maybe hurt themselves, they're going to fall down, but they're going to be better off for it in the future.
Yeah. And
So,
so, and I mean, it's not a simple thing either, right? Like it's, you know, life is complex, but what we want really is to put the power back in the hands of children and families, right?
Mhm.
So for parents to actually trust themselves, they get a lot of kind of information around what it means to be a good parent. You know, and a lot of that is that they, you know, their kid is safe, that they're supervised, that they're succeeding, that they're doing this, that they're doing that, then they're doing the other. But when we talk to parents, we're like, we really want to strip all that away. And it's like, what do you want the most for your child? What are your deepest values in terms of what you want the most for your child? And often parents talk about, they want them to be resilient, they want them to be independent, they want them to be happy and content and those kinds of things. And so if you focus on those kinds of things, then what are the kinds of experiences that you want your child to have to support that? Are they getting those kinds of experiences? And we asked them to think about, like you had done, Dana, around, your childhood memory and all of the things that you used to do. And so are they allowing their kids to do those things? And if not, why not? And so it's really, it's having parents think about what they value the most and realize that they understand their kids better than anyone, right? And so if they strip away that noise, they understand their child, they explore with their child the possibility of freedom, they start to experiment with that, and they, keeping in mind the situations that they live in. Some people live in neighborhoods that are less able to allow this kind of thing. There's a busy road nearby or whatever, right? So we really want to put the control back in the hands of children and families for them to really fundamentally think about what's important to them and not have this be yet another message of finger wagging. Here's another thing you're doing wrong as a parent, right? Because as a parent, we get enough of that already.
And there's also one good thing that might put parents a little bit more at ease. I think it was a CBC article about your work referring to, I think it was the chances that a child will end up with a serious injury is something like 1 in 14 million. Was that right?
That was for kidnapping. Yeah, it's 1 in 14 million. Yeah.
Oh, for kidnapping. Okay.
For kidnapping. Okay. But we've also looked, like if you look at the statistics across Canada, so there's we have stats from 2007 to 2022 of childhood deaths. And in that entire time span, there's been 2 deaths from falls from play equipment, for example, whereas there's been I like over 2,000 deaths from motor vehicle crashes for kids, right? So, and actually in that whole time span, there's been 0 deaths from falls from trees, for example.
Okay.
All of this is making me think about the involvement of schools as an institution to support parents in all of this, right? Because, parents are with their kids when they come back home from school, if they go to school, and on the weekends, hopefully when parents have some downtime from work. So I kind of wanted to know from the both of you, one, how important is school in the involvement of allowing risky play or mitigating a healthy level of risky play? And 2, are either of you having these conversations or participating in any way, shape, or forms of conversations happening with, for example, the school system in Canada, right, to really encourage a healthy level of risk in children?
You want to go first, Sue?
No, you go ahead. You have more experience with this than I do.
Yeah, we've actually been doing a lot of work with schools, and Luigi, I think you're picking up on something really important around also a conversation around equity, right? So not all kids have access to, beautiful places to play and stimulating places to play, but almost every kid goes to school. And so schools are really important venues to help support kids having these kinds of experiences in their lives. And they spend most of their waking hours at school, right? So we want to really think about schools. And so we actually have just released a tool a few months ago for schools. It's at teachers.outsideplay.ca. .outsideplay.org. So teachers.outsideplay.org. And it's based on research. One of my PhD students, who's Megan Zenny, she's a teacher, been a teacher, for decades, mostly outdoor based. And so she, over that time, has really learned how to support outdoor learning and risky play in schools. And so she's built a whole practice around helping other teachers. And in her PhD, she worked with other teachers who do this. And they came up with this tool to figure out what do they wish they had known when they were starting out? What were some of their biggest challenges and things like that? So it has a 16 little 90-second, 2-minute videos around the key issues, right? So what is the difference between a risk and hazard? How do you do a risk benefit assessment? How do you deal with urban hazards, rural hazards? How do you make sure the kids have the right gear, even though, like how do you start a lending library so that the poor kids don't have to worry about having the right gear? How do you make learning visible when you're outside? How do you teach math? How do you teach English? Those kinds of things. So it's really digestible, kind of bite-sized, because we've researched what are the challenges here, and here's the solution for them to start moving this along. And now we're just having more and more conversations with schools to help support that learning journey with them.
No, that's amazing, because I always think about, it really does take a community to raise a child. And it's really, parents are superheroes. They just do so much, and then there's just no sleep, when the baby's born, and then there's all these things that you have to worry about, and then you think about risk and really bringing them as thriving adults. So any help you can get is always beneficial, right? And if the society is moving together to make this happen, especially through schools, why not? So this sounds like an amazing tool. Again, that is at, what is it, teachers.outsideplay.org.
Yeah, teachers.outsideplay.org. Yeah.
Amazing.
I know, there's a lot to think about. It's good. And everyone who's interested in this topic, please follow Suzanne and Mariana's work. It's really interesting. So the last question we have, we'll start with you, Suzanne, is if you could change one thing related to health and fitness in children in Canada, and you could change anything today, what would it be?
Yeah, maybe not so much the fitness. I won't comment on that. I actually, this is just very high level. I wish we could legitimately and proactively prioritize prevention instead of reaction in all aspects of health. I think that would dramatically transform our healthcare needs, our system capabilities, the economic burden that health issues have on our society. It's trite but true. An ounce of prevention is worth a pound of cure. And unfortunately, we know that the cures are not always perfectly complete. And so that aligns for preventing serious injury, and it aligns for preventing all these consequences of a lack of this type of play, increasing sedentary behavior, increasing screen time, all of that stuff. So preventing that will, similarly lead to better health outcomes: physical, mental, social, emotional health. And as Mariana said, that approach really has to be balanced. It has to be equitable, culturally sensitive, and based on evidence-informed strategies. So that's what I would do. I think it's time that we really prioritize prevention.
Prevention. Okay, for sure. Great answer. And Mariana, same question to you.
Yeah, thanks. I think Suzanne's answer was fantastic. And I guess, specific to this topic, what I would add to that is that I would love to see every child outside playing every day, everywhere, so that it was the norm for children to be on the street no matter where, and that we actually built our cities, our neighborhoods, and the way that we think about how society functions around children in our society, outside as part of it, and playing. Yeah.
Outside playing. It's great. Great answer.
Love that. So everyone, you've heard it here, right? So preventive care, preventive health, as well as outside play are just amazing, especially when we think about risk play for children and really supporting them into developing into functioning adults. Really want to thank both Suzanne and Mariana for being on with us today. Very engaging conversation. A lot of opportunity to ask follow-up questions. I really had to hold back because, whether it's in the research that Mariano is doing or the day-to-day for Suzanne, I'm just so interested. I just have a lot of more questions. But, for anyone else who also has questions, you can always follow both Mariana and Suzanne on X, formerly Twitter, Suzanne at Suzanne Benno, and let's see, Mariana at Brussoni, both of them again on X. And you can also visit the website outsideplay.org, as well as teachers.outsideplay.org, right? Just to get an understanding of new website and all of the work that they're doing, really. So really want to thank the both of you for joining us today. And Just to wrap everything up, just wanted to let everyone know that remind everyone really to not forget to follow us on Let's Move Canada on Instagram for latest updates. And you can also head over to our website, chfi.fit, to learn more about our mission, to know when these episodes are going to keep coming out. Do not hesitate to DM us if you want to see someone on our podcast or if you want to be featured on our podcast. And with this, I leave all of you today in great spirits. Thank you so much for joining. Until next time.